Okay, welcome to this talk on hip MRI anatomy. So this will be covering primarily normal anatomy, and we will discuss the pathology in later slides. So if we look at the axial plane here, we're primarily going to be ordering an MRI to look at labrum, possibly cartilage surfaces, muscle and tendon injuries, bursa, to give us a little idea of the joint capsule and the femur and acetabulum. So as we look at these views here, you see the scout view here. This is the first one we're looking at. It's going to cut across the very top of the, just above the femur, and primarily looking at acetabulum, a little bit through the sacrum. So if you look at the here you see the acetabulum, here the ACT, you see the piriformis, glute med, and glute min right here. See glute max over here. You see the rectus abdominis in the front, and so you kind of see some good anatomy here. Then if we go down a little bit further, you see the femoral head, greater trochanters out here, TFL, sartorius, is all here. You see the bladder here, rectus abdominis. See the glute med, glute min out here. So you see some good obturator internus. So you see some good muscle function here, along with the joint and capsule here. So gives you kind of an idea of what you'll be looking at if you were ordering MRIs. So here's from your textbook, looking at the muscle regarding here. You can kind of see the labrum here. If you were to cut it right across the axial portion here, you can kind of see the where the labrum. This is the idea of where you're going to be looking at for labral tears, along with the acetabulum here for the hip. Iliopsoas, rectus, and sartorius, or rectus femoris here. Sartorius be out here. And the tensor muscle, glute min, there's your greater trochanter and your glute max. So kind of see some good anatomy here as well. So the coronal plane we'll be looking at here is going to be looking at the labrum, the joint space, subchondral, acetabular, and femoral marrow, or interior portions of the bone. So it's a pretty good idea of what we can be looking at in this plane. So here you see the scout views that you'd be using. These are the slices that they would take for this view. And here you see the femoral head, neck, part of the femur. You see the muscle contributions here. So I'll let you kind of look at those, but there's a ton of detail here on what's going on with these muscles and function here. So kind of get an idea of what you'd be looking at in regards to anatomy with this cut. And so here's a little more detailed. So you see the obturator externus here. You see the adductor brevis, adductor magnus. Gracilis will be down here. You see your vastus lateralis, vastus intermedius. The glute med is out here, glute min in here, acetabulum, femoral head. So and you can see your sacrum through here, internal organs here. So you kind of get an idea of what you could visualize with this type of cut. And if you go a little bit further, you see the same adductor muscles, TFL. In here you can see the iliacus forming here, and the bladder. So you see some good details here with regards to anatomy. Then if we go to the sagittal plane, you see the cuts here. Here we're primarily looking for labrum, cartilage, and muscle tendon. And here's your cuts here. So we're slicing across this way and across this way in these pictures. So you see the femoral head, acetabulum, glute med, obturator internus, obturator externus, glute max, adductor brevis, sartorius is here. So you kind of see a good cut through there. And then if we come over here to this cut and look over here, you see a lot of these muscles as well, glute med, glute min, glute max. So you see the adductor muscles, the rectus femoris, sartorius. So you can kind of see a good idea of what you'll be looking at with this cut. So that kind of concludes brief anatomy. Obviously, look at your anatomy books and go back and look at your detail and cross-sectional anatomy. May help with these MRIs.